Hi everyone, Rebecca Rigney is my name. I'm a paramedic with the National Ambulance Service, and I'm also a Bachelor of Science in Paramedic Studies student in the University of Limerick. I have a particular interest in the care of older adults. So that's what this kind of research is about, is to see where paramedics can play a better role in looking after our older adults. So at the present time, if somebody over 65, if anybody calls 999 for an ambulance, really the only pathway we have is to bring them to the emergency department. So that's and the emergency department is an important place for people to be when they need urgent and emergent care. But a lot of our older adults are, as we know, our population is changing. We're living longer with more chronic conditions. So the emergency department may not be the most appropriate place for these people. And I suppose the emergency department isn't benign. Older adults are higher risk for hospital acquired infections, and that's even more obvious now with the current global pandemic. People are high risk for infections. So sometimes, so there's a lot of research in, I suppose, in other countries, not so much in Ireland, unfortunately. We don't have a huge pre-hospital data set, but there's a lot of evidence to show that alternative care pathways, like more community care, and kind of going back to the old home visit, the house calls that GPs used to do, to see if that would be a better option for our older adults. And just to note then that as paramedics, we're seeing a lot more calls for older adults. Just in 1 month in 2019, there was in excess of 1,300 calls to the 999 service, for falls alone for older adults. So there's a huge demand on emergency care. So what I'm planning to do is, so this is all future tense. A lot of what people have presented is research they've already done. I'm planning to do this study over the summertime, because I'm not a full-time student. I'm working and studying as well. So what I'm hoping to do is look at there's 3 clinical trials going on in the emergency department in the University of Limerick, University Hospital Limerick. So there's 3 studies going on. They're the SOED, SOLAR and OptiMen studies. So these are all around the care of older adults and looking at advanced screening and frailty screening in older adults. So just a quick rundown of them. So the SOED study is looking at the AICUR screening tool to see if that can predict worse outcomes for older adults. There's also a qualitative element to this study because it's looking at the barriers and facilitators to its use in clinical settings. The SOLAR study then is it's probably a level above the SOED study because it's looking at multiple screening tools, whereas SOED is AICUR specific. And then the OptiMen study, which was a huge study that was looking at a multidisciplinary team approach, so a more holistic approach to care for older adults. And kind of the main findings out of that was that patients who got the MDT approach had a more comprehensive assessment, and they spent less time in the emergency department. So the aims of my study then is to see if pre-hospital data can be used to identify risk factors for adverse outcomes for older adults who attend the emergency department. So I suppose paramedics have a unique opportunity to observe patients in their home or in their long-term care setting, and we can see so sometimes it can be hard once a patient is in the emergency department to assess their mobility and where they're at, what their baseline is, whereas we can see them when they're at home, and we see whether they're mobilizing to the bathroom by themselves or they're mobilizing outside. So we have a lot to contribute to these to the screening of older adults. So we can see their day-to-day living situation, whether they've got enough food in the house, that it's warm, whether they've social supports, and lots of other factors like that all play into either their outcomes being better or worse. So, and what we want to do is improve the outcomes for older adults. So, the objectives then of my research would be to describe the types of the characteristics of patients who attend the emergency department. So the characteristics of over 65s and who are in the ED, and then break that down by how they came to the emergency department. Did they come by ambulance, and were they seen by paramedics, or were they did they self-present? Did they have a GP referral and go to the ED themselves? And then I want to look then to compare the outcomes by sorry, I'm mixed up now, to compare the outcomes from the data of the randomized controlled trials at the time the patients were in the emergency department, so what their baseline was when they presented, what their outcomes were then at 30 days and then at 6 months. And then to look then at the pre-hospital side of things to see if the patients who came by ambulance would be better served by alternative care pathways and more community-based care rather than the ED being the only option for them. And then the last then objective would be to look at a subset of our ambulance care reports, so the patient care reports, and to see if there's ways to identify additional risk factors in the patient care reports. So yeah, the methodology then that I'll use. So this will be a retrospective observational cohort study. It'll be over a number of weeks, and what I'll be doing is looking at existing studies and as I said, there's not a lot of pre-hospital studies in Ireland, so I might be looking at what they're doing in other countries, and then I'll be familiarising myself then with the data software that I'll be using. There'll be a literature review then done of older adult care in a pre-hospital setting, and then I'll be gathering data from the randomised controlled trials and the PCRs. So that will all then the data analysis section. So there'll be data entry needed. They'll be coded, then there'll be SPSS data software used, and then there'll be statistical methods looked at to examine relationships between the data variables. So then there's specific within the RCT data, then there's specific parameters that I want to look at, and they're patients' pain scores, their frailty scores, and the emergency department length of stay. So because there's potential then to reduce the length of stay if these patients get better screening. And then once they've left the ED or they've gone to a different care setting, I'd like to look then at their if there's any functional decline, if there was hospital readmission or repeat emergency department attendance, and then the mortality outcomes from for these patients, these group of patients. So then the PCR review then will look at risk factors for adverse outcomes. So we already know that patients who are living alone, who have higher risks of isolation, and if they have reduced social supports, like people not calling to their house, particularly now with the pandemic as well, I'm seeing more patients who are living in poorer conditions because there's nobody calling over to see them, so they're living without light in the house because they can't stand up to change a light bulb, or they're going to stand on a chair themselves to change light bulb and they end up falling. So there's a lot of care. These patients have a lot of care needs, and they may benefit then from a more community-based approach. So then the results of these studies, then I'll look at the demographics of the older adults who are in the emergency department, look at what their risk factors are, and look at their risk factors for adverse outcomes, and then the data analysis of what the paramedics can collect with their patient reports. So kind of following on from the study then, and this won't happen, this won't be in the scope of what I'm doing this summer, but it may set it up for further research, is to see if there's potential to develop advanced care pathways that will be delivered by paramedics. So yeah, then to see if there's the scope then for paramedics to assess frailty. So if like paramedics can if we can start the screening process early, that might mean that these patients can be fast tracked to a different care pathway within the ED, so they get reviewed by the geriatrician team quicker, they get the occupational therapy, they get the physical therapy team, they get a more holistic approach to their care, which will hopefully then reduce their risk of adverse outcomes. And then what I'm hoping to do then is I'll have to write a report on what I've done, and then hopefully that will go on for publication, and then maybe a conference presentation going forward. So that's kind of my presentation. If there's any questions, I'm happy to take those.